The undergraduate program is alive and well. It's a robust program. Every year we have between 200 and 300 students who walk through our doors.
The M1 Neomed students come to Canton to learn a general adult physical exam, which I help to teach them with our clinical nurse instructor. The M2 students from Neomed come down to Canton to learn several things, including seminar, which is interviewing, physical exam techniques, and clinical discussions where they learn how to write SOAP notes and formulate assessment and plans.
The clerkship program at Aultman is a 6-week clerkship designed for third-year medical students. It is a comprehensive rotation that involves inpatient medicine, outpatient medicine, procedure workshop, and exposure to hospice and palliative care.
Since I'm the site director for the clerkship, my goal is to have my students gain an experience of what internal medicine is, understand it, enjoy it, and maybe not know all of it within the 9 weeks that they spend with us, but enough to be able to use it for the rest of their lives.
Our undergraduate program here that we have, the clerkship for the third-year students, what we try to do is give them a snapshot of pediatrics. You know, the students are here 4 weeks. There's a lot to pediatrics, and students come at all different levels of experience and knowledge about pediatrics. So on their first day, we do a bit of an assessment to see what that knowledge base is, just kind of informally. And then we structure the next 4 weeks then based on what their interests are, what some things, basic things they need to learn, and try to get them to, at the end of those 4 weeks, feel like they can comfortably examine a pediatric patient, think about pediatric issues in a little bit different way, and hopefully enjoy pediatrics.
Dr. Gills and my students rotate. Clinically, they get time within our OBGYN ambulatory clinic. They also have time that they spend on the birth center, labor and delivery. They also have part of the rotation doing the gynecology portion of the rotation is spent in surgical, in the ORs, and following patients in that manner.
Each week the students engage in what we call PPI cons, which is basically they pick a research paper and they present it to the peers and to myself. And the purpose of that is to teach the students how to look at primary source evidence and learn to critique it, as opposed to secondary source, which is a textbook, etc., which is already digested information and synthesized, but trying to put them in touch with the raw information to learn how to synthesize that.
What we do here for the third-year clerks is provide them an active clinical rotation, which means having to work on at multiple sites, inpatient, outpatient, partial hospitalization program, and outpatient, as well as consultation liaison psychiatry. So that is multiple areas of psychiatry which they go through in a very active and challenging rotation. So these students are supposed to not just follow us or shadow us all day. They're actively involved in learning and taking care of patients directly.
My role as clerkship director is to oversee the clerkship itself and its curriculum, and to assign medical students in their third year to rotations within the Department of Surgery.
For undergrads, I arrange for their, usually it's a 4-week rotation. I have an associate, Pat Franson, who assists in that, and she's helps with the scheduling aspect. And we make sure that they are scheduled into the emergency department and get an experience that's broad and the type of things we want people to see in the emergency department.
I chose to go to Northeastern Ohio Medical University because I was born and raised in Canton, and it's a local medical school, and they have an accelerated program where you can, apply right out of high school and do your undergraduate degree in less amount of time. So I thought that was an advantage to, I knew medical schools that I wanted to do, so why not go that route and be able to stay close to home and in a great area.
You'll come in the morning, you'll be assigned a few patients. As far as how many you do is kind of up to you. They give you the freedom to take as many or as much as or as little as you can handle, and you go and see the patients and just kind of check up on them around and ask the appropriate questions. Write a note, mostly on the computer, sometimes written, and a resident will follow you and kind of talk over what they thought and look over your note, and at that time you just kind of learn what was the most appropriate thing to do, what you should have done or what you did well, and you just go from there.